How do I follow up on abnormal Pap test results? If you get an abnormal Pap test result, it can feel confusing or worrying. But knowing what steps to take next is important for your health and peace of mind. First, remember that an abnormal result does not mean you have cancer. It simply means some cervical cells look different from normal and may need further evaluation. Your healthcare provider will guide you based on your specific situation, including your age, previous screening history, and overall health. The next step often involves repeat testing. Your provider might recommend waiting a year or 3 and then doing another Pap test or testing for human papillomavirus, or HPV. This helps see if the abnormal cells go away on their own or if they persist. Sometimes, testing for high-risk HPV types, especially HPV 16 and 18, is done because these are most associated with cervical cancer. Reflex testing may also be performed, where if only one test was done initially, the other is done on the same sample to give a clearer picture of your risk. If the abnormal cells are more concerning or do not improve over time, your doctor may suggest a procedure called colposcopy. During this exam, a special magnifying instrument is used to look closely at your cervix. If suspicious areas are found, a small tissue sample called a biopsy might be taken. This helps determine if there are precancerous changes and how severe they are. If biopsy results show high-grade changes, such as cervical intraepithelial neoplasia, 2 or 3, treatment options are considered. These treatments aim to remove or destroy abnormal tissue to prevent progression to cervical cancer. The specific treatment depends on how extensive the changes are and your overall health. Guidelines now focus on a personalized approach, considering your individual risk factors. This means your healthcare provider will tailor follow-up plans to balance early detection with avoiding unnecessary procedures. After treatment, or if your provider recommends conservative management, regular follow-up testing is essential. Usually, this involves repeat Pap and HPV tests every 6 months to 3 years, depending on your risk level. Timely follow-up is crucial because catching and treating precancerous changes early can prevent cervical cancer from developing. Ignoring abnormal results can increase your risk, so staying engaged with your healthcare provider is key. Always discuss your specific results and follow-up plan with your doctor, who will base recommendations on the latest guidelines and your personal health history. In summary, following up on abnormal Pap test results involves repeat testing, detailed examination through colposcopy, possible biopsy, and treatment if necessary. This process is designed to catch and treat any precancerous changes early, helping to prevent cervical cancer while reducing unnecessary procedures for low-risk cases. Staying in close contact with your healthcare provider and following their advice ensures the best possible outcome for your health.